Now, anecdotally, I've heard in the market that doctor pay has kind of stagnated. It's not what it used to be as the market, the value of the dollar is deflated, et cetera. Is that um, is this part of the story? Doctors are making less money long term because they kind of get chipped away by all the different vendors and everyone else in the supply chain.
Yeah, I mean, you and I are young enough to kind of know healthcare as it stands today. But if you were to ask kind of your parents, hey, what was it like to see your family doctor? You would go in, you'd have an hour with the doctor. They would go through every ailment head to toe that you're facing and come up with a treatment plan. Now, healthcare is really compartmentalized. So it's a machine. Your family doctor is seeing 60 patients a day to make the money that a doctor 20 years ago would do seeing 20. And so they're a machine. They have to get you in and get you out. And they really focus on the small, minute, kind of myopic part of healthcare that they focus on. And, in addition to that, Medicare has been reducing rates. So in healthcare, Medicare, CMS sets the price point, and almost every private payer will follow suit. So as Medicare keeps carving down, for example, the doctors that we are selling to currently, they just faced a 15 to 17% rate reimbursement cut in January of 2022. So overnight, they lost 15% of their revenues for the same procedures they did last year. Now, for my organization, that was good for us because people are seeking us out, trying to figure out how they can recoup that 15% back, right? But yeah, healthcare is being squeezed. And what a lot of people don't realize is, say you get a surgery done at the hospital. There are two parts of that fee. About 80, 90% of it goes to the hospital as a technical portion. So it pays for the facility. Only about 10 or 15% actually goes to your physician. And so what physicians realize is in the hospital, they're just a number. They're being told how to deliver care as opposed to choosing the care that they want for their own patients. And if they move all their procedures out of the hospital to their own facility, now they get to recoup the technical portion and the professional portion, and they get control of the spend. But they're using the products they want and delivering the care they want. So we're seeing a huge migration of, procedures and doctors leaving hospitals to open up their own surgery centers. And I think it's great.
But when they get to their own surgery center, they're on the same reimbursement program from the government, right? So isn't that always going to limit the type of quantity, like the quality of the care, the time they can spend per patient, because there's a cap?
There is. It's interestingly enough, say you were going to get a stent put in your leg. If you were to have it done at the ambulatory surgery center versus the hospital gets paid twice as much more. Same physician, same technology, same outcome.
Why?
It's just
the overhead?
It's just the game that they have in place. And
right, but when you say it's a game, do they need that money? Is that an inherent cost? Or they're just saying, hey, let's charge as much as we can because we're bumping heads with the insurance companies and they're trying to undercut us, so we're going to ask for too much?
I think on an ethical level, you could argue that the hospital is treating indigent patients and that they have procedures that are loss leaders for them. So the procedures that are profitable need to feed the rest of the hospital. The reality, though, is cost of care should be delivered at a really affordable price point where we're incentivizing our brightest to go into healthcare and be doctors, and our brightest scientists to keep developing new technologies and new paths forward. And unfortunately, because healthcare is somewhat broken in the US, we're not seeing that. Our best and brightest that used to be scientists and doctors and mathematicians are now going into finance and investments and sales positions because the income is not what it used to be.
And so the income, though, the reason why people are making less is because the government, on a real dollar basis, is reimbursing at lower rates through cuts or not changing it to match inflation? Or is it because the cost structure has gone up and there's been no adjustment to raise the rates, the reimbursement rates as well? What's the driver? Is it price compression or cost scaling, or both?
I think it's both. The reality is every year Medicare takes 6 months. In June, they put out their proposed rates for the next year. And then in December, they put out their final rates. And over that 5 to 6 month period, they are supposed to be looking at every dollar that's spent, everything that's reported, every cost of every implant, and they're coming up with reimbursement. And the reality is they're just driving down the reimbursement for physicians. So physicians at a certain point said, hey, I don't want to be in the hospital anymore. My surgery time is not guaranteed. I was supposed to do this procedure at 2. It's now 9 p.m. and I'm finally getting the patient into the room. Or, hey, I've used this, company's widget for the last 5 years. And then today they're telling me I can no longer use it because a hospital just negotiated a contract with a different company's widget. And so physicians have just gotten really, really tired of being told how to deliver care, not having the accessibility to the labs, and they can't give the patient experience that they want. And so when you had that kind of boiling over, and now the ability to have these outpatient facilities, and they've been vetted, and it's the fastest rate of growth in healthcare right now. I can control everything, make more money, and have a better quality of life. And then the studies are really evident that the outcomes are better for patients in the outpatient facility, and the doctors and the patients are happier. So for me, it's a huge win. The cost to the Medicare comes down. Doctors are happier, their staff is happier, the patients are happier, and the outcomes are better. And so it's a win all the way around. And that's why kind of finding this space for me and Margin was so important, because everything we do is trying to help a problem that's systemic to the healthcare system in the US today.
So this is a macro shift. We're seeing, is that right? Like doctors are essentially moving away from hospitals, or is it happening in piecemeal and it's not a macro shift, right? If someone was to study this, are we watching the decline of centralized hospitals?
Yeah, there's, so my first hospital I ever sold into was Hahnemann University Hospital in Philly. Big teaching center, residency programs attached to Drexel Medical School. Last year, they went out of business. They went bankrupt. It was a pillar of healthcare in Philadelphia. I probably repped 3,000 surgeries at that hospital. I spent my 20s and 30s there. And so what we're seeing is there's a huge migration of physicians out of the hospital into their own facilities. It's much akin to the huge migration that we saw in the 90s from Sears, Macy's to, the Gap and Banana Republic and specialized stores that focus on a few things. Whereas 30, 40 years ago, you bought everything you needed from Sears Roebuck. And now Sears is just kind of in a few locations across the country, right? And so I think what we're seeing is people like having really fine-tuned choice on the items that they want to buy or service, and having specialized opportunities is kind of what in the US of what is, what the average consumer wants.